Hello friends, today we're going to talk about the real cause of acid reflux and how to fix it. So, we're gonna understand today exactly what causes heartburn, what causes acid reflux, and what you can do to get rid of it once and for all. You know, a lot of people suffer from this problem, and even doctors sometimes have difficulty identifying the root cause and treating it. So, I'm gonna show you some research and explain everything to you. I think most of you already know that after a big meal, or a meal containing certain foods, there's a burning sensation in your chest, right? And sometimes it feels like there's something stuck in your throat. Sometimes you have a sour taste in your mouth. Well, this is what we call acid reflux or heartburn. Okay, and this is not a disease. Well, what is happening? Well, first let me explain. What is this little thing here called the lower esophageal sphincter? But when this muscle does not close properly, the acid backs up into the esophagus, and you feel this burning pain, which we call acid reflux or heartburn. Now, most of the time, 90% of cases, this failure of the less or the lower esophageal sphincter happens because of low stomach acid. Okay? So, when there's not enough acid, the sphincter doesn't get the memo and stays relaxed, allowing acid to go back into the esophagus. So, this means that most cases of heartburn are caused by low stomach acid, a condition known as hypochlorhydria, and the question is, why does low stomach acid cause acid reflux? Well, when food enters the stomach, it releases a strong acid called hydrochloric acid with a pH between 1.5 and 3.0. That's a very acidic pH, right? This acid is essential for digesting protein and meat and other things. It also helps eliminate bacteria present in food, and stomach acid also activates digestive enzymes, such as pepsin, which is activated at pH of around 1.5 to 2. The acid also signals the pyloric sphincter, which is located at the exit of the stomach, to open and allow the mixture of food, acid and enzymes called chyme to flow into the small intestine. If the acid level is low, the chyme will not be digested properly in the small intestine, and this creates a favorable environment for bacteria to grow. These bacteria ferment carbohydrates in the stomach. Excessive bacterial growth and poor digestion create excessive pressure in the stomach. So, when this pressure is too high, but the pH is not acidic enough for the porous sphincter to open, the body releases this pressure by opening the less. The pressure then rises into the esophagus and causes the symptoms of heartburn and reflux, which is often confused with excess stomach acid, even if you have low acidity. Any contact of acid with the esophagus causes pain and discomfort because the esophagus is not designed to withstand acid. Over time, this weakens the lower sphincter, making it leaky and worsening the problem. Low acidity also leads to inflammation in the intestine and throughout the body. Chronic inflammation damages the small intestine, impeding digestion and the absorption of nutrients, increasing food intolerances, triggering small intestinal bacterial overgrowth, which we call SIBO, and causing leaky gut. So, if you have heartburn, acid reflux, GERD, which is a more severe form of this condition, you have probably taken anticides or acids to neutralize the stomach acid. However, when you take an acid to neutralize the stomach acid, if you have low stomach acid, it's not going to help you. In fact, it can make things worse. Okay, so, it is important to identify the underlying cause and treat that. So, the question is, who gets low stomach acid? Well, it can happen to anyone, but several factors can cause low stomach acid production. These include aging, poor diet, chronic stress, persistent inflammation, use of medications such as antacids and proton pump inhibitors, PPIs, and also deficiencies in nutrients necessary for acid production. Another common cause is untreated hypothyroidism, because thyroid hormone is essential for the production of stomach acid, and infections caused by Helicobacter pylori, a bacteria that attacks the stomach, can also hinder acid production, causing poor absorption of iron and vitamin B12 and also contributing to SIBO. Alright, so if you have heartburn, acid reflux, or GERD, what should you do? What are the steps to eliminate heartburn, acid reflux, and GERD forever? First, you need to know the three main symptoms of GERD. GERD is a more severe form of acid reflux where the condition persists. This can cause serious complications such as scarring, ulcers, and even esophageal cancer. GERD is very common. It is estimated that about 20% of the United States population suffers from it. In addition to heartburn, acid reflux and GERD can cause a bitter or sour taste in the mouth, difficulty swallowing, sore throat, dry cough, hiccups, a feeling of fullness in the stomach, dark stools, nausea, vomiting, severe cramping, and pain when lying down. For decades, medicine has treated patients with heartburn and GERD primarily with antacids or acid blockers. While these medications relieve symptoms, they don't address the root cause of the problem. Therefore, many people end up relying on these medications for the rest of their lives. And this is concerning because the side effects of these medications can cause osteoporosis, bacterial infections, and kidney and liver damage. To eliminate reflux at its root, it's essential to understand why low stomach acid causes acid reflux, You see, when food reaches the stomach, it releases a strong acid called hydrochloric acid, with a pH between 1.5 and 3.0. This acid is essential for digestion, especially of proteins and meats. Furthermore, stomach acid helps eliminate bacteria present in food and activates digestive enzymes, such as pepsin. Acid signals the pyloric sphincter, located at the exit of the stomach, to open and allow the mixture of food, acid and enzymes called chyme to flow into the small intestine. If the acid level is low, the chyme will not be digested properly in the small intestine, and this creates a favorable environment for bacteria to grow. These bacteria ferment carbohydrates in the stomach. Excessive bacterial growth and poor digestion create excessive pressure in the stomach. When this pressure is too high, but the pH is not acidic enough for the pyloric sphincter to open, the body releases this pressure by opening the less. This pressure then rises into the esophagus and causes the symptoms of heartburn and reflux, which is often confused with excess stomach acid. Even if you have low acidity, any contact of acid with the esophagus causes pain and discomfort because the esophagus is not designed to withstand acid. Over time, this weakens the lower sphincter, making it leaky and worsening the problem. Low acidity also leads to inflammation in the intestine and throughout the body. Chronic inflammation damages the small intestine, impeding digestion and the absorption of nutrients, increasing food intolerances, triggering small intestinal bacterial overgrowth, which we call SIBO, and causing leaky gut. Alright, so that's the first part. Now let's talk about what to do to fix this problem. The first step is to increase stomach acidity. To increase stomach acidity, you must stimulate the nerves that supply the stomach, because when you stimulate these nerves, it will increase the production of gastric juices. And the best way to do this is to drink apple cider vinegar diluted in water before each meal. Do this for 3 days and observe if your symptoms are relieved. If yes, this indicates that low stomach acid is the cause of your problem. And if you continue with the apple cider vinegar, it will prevent your condition from getting worse. And if you continue with the apple cider vinegar, it will prevent your condition from getting worse. To do this, you need to drink a mixture of 3 garlic cloves, 1 tablespoon of apple cider vinegar, and 1 glass of water. Let's say during the day. Do this every day for 30 days. Garlic naturally eliminates Helicobacter pylori. This bacteria usually causes gastritis, which is inflammation of the stomach, and it can also cause ulcers and even cancer. So, it's important to eliminate it. The third step is to improve digestion. Improve digestion by taking a digestive enzyme supplement after each meal. This will enhance digestion and nutrient absorption. These enzymes help break down food, aiding in its digestion and reducing the risk of bacterial overgrowth in the stomach. And also, if you want to learn the most important vitamins that regulate acid production and reduce inflammation, click the link in the description below, and please share your comments below this video. Let me know if you found this helpful. I'd love to hear from you. Thank you for watching. May you be blessed.